It's not unusual to feel anxious the first time you meet your oncologist. However, as an oncologist, I see it as my responsibility to put you at ease and help us both make the most of our time together. People deal with that anxiety, in my experience, in one of three ways. The first group of people who deal with anxiety by asking lots and lots of questions, and I can see that giving them the information that they need gives them control back and it helps to manage that anxiety quite quickly. A second group of people have no questions at all and don't want to know anything. That can be a challenge because I do need you to understand what's happening. This is your body, you're always in control of it, and you need to understand why I'm making the recommendations that I'm making. The third group of people have got absolutely no time for questions, and from the second I meet them, they just want to jump straight to a conversation about treatment. Now, unfortunately, I am going to have some irritating questions for that patient group because my agenda for the first time I meet a person in my clinic, firstly, is to get to know them. I need to know who you are in terms of your past medical history, in terms of your day-to-day life and what your priorities are. The second thing I need to do is to check your understanding of everything that's happened so far. A lot has happened usually in the weeks before we meet. So I want to check your understanding of the results of the investigations that you've had. I'll often show you your scan pictures together so that you go into treatment knowing exactly what it is that we're tackling. The next thing that I need to do is talk to you about your treatment. And at that first appointment, I'd hope that you'd either leave with a treatment plan and a treatment start date. Now, sometimes I do need to request further tests. And even if that's the case, I'll always explain to you why I need the test and what the plan will be depending on the results of that test. So you would leave knowing, right, if this test shows this result, I'll be having this treatment, or if this test shows this, I'll be going down a different treatment route and that's what that looks like. So you'll always leave with information that I hope will make you feel more calm and more in control of your treatment that you need. Equally at that appointment, I'm going to introduce you to people who can also support you and your family, such as a clinical nurse specialist or some of the radiographers that deliver the treatment. One thing I say to everybody when I meet them is that there's no such thing as a stupid question. I'd rather that you picked up the phone, called and asked a question rather than lay in bed at night worrying about something. It's my job to give you the confidence that you know that you can contact me as your oncologist at any time from the day that we meet.